Watch step by step as I create a 3D areola tattoo, also known as a paramedical tattoo for those who have survived breast cancer, mastectomy, or had top surgery. This is a 3D realism tattoo to help replace part of the bodily anatomy for clients that have scars or removed tissue. And I always begin by creating the outline of the nipple and shading it in a little bit with the pigment that's left in the needle cartridge so that I'm able to begin creating the outline for the size and the shape of the nipple, which then helps determine the size and shape of the areola. This is going to be a melanin-rich nipple, so I'm using a darker pigment color for a Fitzpatrick 3 or 4, and I am outlining the shape of the nipple, and now I'm going to switch from my 12 one-round liner, sometimes a 3-round liner, to a 13 curve magnum needle so that I'm able to begin shading the areola, which is the darker part of the breast or chest tissue that is emerging from around the nipple. Using a larger needle configuration is going to allow you to have a more airy appearance of the areola, controlling the amount of color that you're going to implant and how fast. I usually have my machine speed anywhere from a 4 to a 6, depending on the tissue that I'm working on and how much pigment that I want to saturate in the latex, but it's different with every client. You'll also notice that I'm adding more shadow or more cast shadow and color below the nipple, because again, if the nipple is going to be sticking out and protruding from the skin, it needs to appear like it is blocking the light from around it, and there needs to be more light at the top, more shadow at the bottom. Now I'm going to go back in with a warmer, more chocolatey brown color, and I'm going to begin whip shading the center of the nipple so that I can create the contrast from the areola and the darker part of the shading, which makes it appear like the nipple is three-dimensional. But I need to start building and blending the color slowly so that it appears that it's realistic, but again, it also has an inconsistent amount of light and dark, because that's how you create the shadow and the appearance that the tissue is moving and is not just one solid color or shade and looks more like a stamp or a sticker. Sometimes I'll also switch to stippling or pointillism, which is, you'll see me doing the tap, tap, tap to implant color, and it almost creates a more textured appearance than whip shading, which is a more smooth appearance. Now I'm going to go in with our creases. Most people have constriction lines on the breast or chest tissue where you can actually see the tissue moving, and it appears like it is going to contract when the client is cold and expand when they're excited. So I like to go in and I like to add a few lines expanding on those creases in the areas of light and dark and the shadow that we've added through the shading process, and then I'll go back in as well and exaggerate the shading to add a second tone of color, because nobody's skin is one-dimensional, one tone. Everybody has different colors blending into their skin, creating that three-dimensional realism appearance. Next, I will add Montgomery or areola glands using the stippling technique. Most clients have lumps and bumps on their breast or chest tissue, and these are sebaceous oil glands that allow the skin to be lubricated because it is thinner and more fragile than other areas of your body. So this is totally normal. A lot of people ask, what are these little bumps? But I like to go back in and just exaggerate a little shadow. And again, it makes the tissue look like it's textured. It adds to a more realistic appearance on the skin. So I like to go back in and add and exaggerate some of those glands, and then go back in finally to the nipple and exaggerate the creases, because that's what's going to allow it to look like it truly is sticking up and out off of flat skin or a flat latex surface. Next, I'm going to switch to a new needle with white pigment. White is going to be the highlight. If the darker tones are going to be your shadow, white is the appearance of light on in a room. And it also helps exaggerate the realism, because nobody, again, has just dark shadow tones. Everybody catches a little bit of light if the area of the tissue is truly three-dimensional. So I'm going back in with that pointillism or stippling technique and just adding a few dots of white along each areola gland. And I'm also exaggerating some of the creases by just adding a little bit of white. This is a single round liner. Again, I like to use my white very crisp with a single round liner. And then I'm going to go back in with my pointillism to the center of that nipple, and usually focusing on the top center of the nipple, because again, most people have light on in the ceiling of a room, And if that nipple is sticking up and out, there's going to be more shadow, being where the light is obstructed because the tissue is blocking it. So this is our finished result of our beautiful melanin-rich 3D areola tattoo. This is a beautiful treatment for those who have had breast cancer or top surgery. If you want more information, send me a DM or reach out in the comments. I'm in Jacksonville, Florida, and I can't wait to work with all of you soon.